The vast majority of my patients come to me on 1 or 2 or even 3 or 4 or more pharmaceutical medications to chase after the symptoms of adrenal fatigue. One of the biggest ones are antidepressants. I'm Dr. Andrew Neville. I specialize in treating adrenal fatigue, and I want to talk to you about these antidepressants because there's a lot of information out there that isn't accurate. So when people have adrenal fatigue, they have their body is stuck in a stress response too much. That creates a bunch of wear and tear in the body in the form of direct damage from stress hormone, in the form of free radicals, which are like the metabolic exhaust coming from a body that's fighting tigers all the time. And these things exist in the blood, and because the blood goes everywhere, this damage or wear and tear is literally everywhere, head to toe, inside and out, including the brain. When you hit the brain with a bunch of free radicals and a bunch of stress hormone, it actually behaves in a predictable way. It will cause depression, anxiety, what we call brain fog, memory stuff, focus issues, even decision making, things like that, insomnia, stuff like that. There's even research that shows that if you put a rat in a model of chronic, unpredictable, mild stress, over time, that rat will develop depression, right? So one of the big things with regard to depression is, patients, it's uncomfortable and problematic. So is the anxiety, and all these symptoms are challenging. So patient goes into their doctor, and doctors want to help them, right? So they treat symptomatically, right? And it's not easy to pick the right drug, right? But if you're lucky enough to pick the right drug to cover up the symptom, you might not feel the symptom. The challenge is you haven't really fixed the underlying cause, and that damage will persist over time. So I'm not against medications, but using medications alone and thinking we've actually fixed something, right, doesn't work. It's actually like putting a little piece of tape over the check engine light in your car. I mean, you don't see it anymore, but obviously you haven't fixed the underlying problem. Now, so all my patients are on all these medications. People are like, well, do I have to get off these medications? What do I do? These medications are not all bad. I'm not here to blast antidepressants. They're perfectly fine. To me, they're like crutches. They're like temporary crutches. And we all need crutches here and there. That's not a derogatory comment. That's okay, right? And we can't go kicking crutches out from underneath somebody unless we've supported them in some other significant way first, which is why a lot of my patients are medicated, and they're like, I don't really want to be on these medications. I don't like the side effects. I don't like how they feel. So they'll try to get off the medications, and they can't, right? Or they relapse or whatever happens. I'm like, of course you did, because nobody helped you to fix the underlying reason as to why you had that depression in the first place. When you fix that, it is way easier to eventually be able to get off these medications. And ultimately, that's my goal, is to fix these underlying problems, help people to get off these medications over time. Now, antidepressants are not all built the same. I have had patients have significant reactions and side effects, and they can be challenging. And there are some issues with them. However, short-term use is not a big issue. The funny thing about antidepressants is we don't even really know completely how they work. And you'll even see, if you read the drug insert, they'll have to say, well, we think this helps with serotonin, right? Most antidepressants are SSRIs or SNRIs, right? And there was just a great research article that came out that said, we actually don't think antidepressants work because they do anything with serotonin. And they looked at it. It was a review study that looked at a bunch of different research. This whole chemical imbalance idea of depression is built on science that's not so incredibly strong. And it's not that antidepressants don't help people with depression. It's just that they might work a different way, right? And one of the ways they actually work, not all of them, but some of them, is they actually help to modulate the limbic system. And if you go to my site, I talk about the limbic system being kind of the CEO of our stress response, right? The puppet master, right? Determining whether a a trigger or stressor is harmful and dangerous, and do we have to jump into fight or flight, or is it the opposite, right? Harmless, innocuous, we could chill out like we're on vacation, right? And that limbic system gets trigger happy. Antidepressants actually help to modulate that a little bit. Now, there are lots of other things that we can use and should use to help to modulate that. Some lifestyle practices, even dietary practices, and certainly other molecules and herbs and different things, which would be safer, less side effects, and all of that. But don't go jumping off all your medication, especially the antidepressants. They're not as problematic as some people will talk about. Fix the underlying problem first, then it's a whole lot easier to get off that stuff. Good luck. All my best.